Hi, my name is Mary Thornberg, and today I'm doing a video critical appraisal of a qualitative study for my Intro to Nursing Research class. And the article that I've chosen today to conduct this appraisal on is titled, What Makes Registered Nurses Remain in Work? An Ethnographic Study. This was a qualitative study conducted by Alstead and others to help determine the contributing factors to keeping registered nurses in the healthcare system in a positive and growing manner. So this was conducted by observation and informal interviews with the participants being mostly registered nurses over a course of a few months. And with this appraisal, I have a few questions to answer about more of the specifics that go into this study. So the first question we have today is, what type of qualitative study was conducted? This study is described by the researchers as a qualitative explorative study with an ethnographic approach. This delves to observe its participants over the course of 4 months, totaling 56 hours of observation. In addition to these hours of observation, the researchers performed 58 informal interviews. The use of participant observation has been used to provide insights into unspoken elements embodied in gestures and physical movements between not only the participants in the study, but kind of the natural occurring events around them. Now, the next question is to describe the type of data collection that was performed. So the researchers were able to give the staff on the floor including registered nurses, assistants, nurses, and physicians, all alike. They gave them a meeting, kind of giving them a verbal idea of what was going to be going on with this research. They then provided them with a printed handout that also kind of told them what was going to be happening before the research actually began. Now, the researchers performed data collection via participant observation and informal interviews, as stated before. This observational period was again spread over 4 months. The interviews were conducted intermittently over a period of 7 days, not consecutively, so they were kind of sprinkled out throughout the 4 months. And this included a total, again, of 58 interviews, 58 interview sessions over 479 events. So these events were kind of just intermittent things that would happen on the floor, and then the researchers would kind of pull away some nurses to ask them how they felt about that, and also documented using field notes to kind of understand what was going on, and these field notes were later transcribed. So next we are going to discuss the analysis of the study. So the researchers performed what's known as a thematic approach to the data analysis. This included reading and rereading all data first, and then the researchers proceeded to use coding for the nurses' expressions towards positive work-related motivation. These coded expressions were then collated to identify patterns within the group and create categories for said patterns. Next, after they used this coding, they used these categories to be checked and to see if they reflected in relation to key factors of the theory of inner work life, which included for this study to be nourishment, progress, and catalyst. So the nourishment kind of entailed the support systems and the coworkers nourishing the work that the nurses had. And then progress was kind of like seeing how the nurses could develop in their own work and how they can improve their knowledge. And then the catalyst was kind of just like getting a jump into the work for the nurses, so they would catalyze the sort of response to certain events in the workplace. Now, next, I was asked to interpret the study's findings. So, based on these tripping over words. Based on these studies' findings, there are a few main elements that have a profound impact on registered nurses for the workday's events in relation to what the researchers called the theory of inner work life and work motivation. So, the first thing was a friendly atmosphere and the own physician's respect towards those RNs in their knowledge on the floor. Next was the importance of visible progress. So, receiving feedback from physicians or from other nurses so that they can improve their knowledge of their daily work ethic, and they can improve how they are going to go about their nursing career. Next was the opportunity for registered nurses to work independently and as well as together with other registered nurses on the floor. And all of these tended to have a positive impact on workplace motivation. These results allowed a deepened understanding of what influences RNs to remain in the work. So if we encourage these nurses to work independently as RNs or work independently together, so RNs working together in their own workplace, and then physicians improving their trust in RNs to know that they know what they're doing, as well as the importance of showing how their progress is being made in the workplace. So seeing that they're making a difference has all been shown to improve the RN's outlook on remaining in this workplace. And I know more often than not, especially in these times, we want to keep nurses in their workplace area. So it is important that we keep a positive attitude and use these findings to implement sort of interventions within the workplace so that we can improve the outlook for our future nurses. So thank you for listening today.